Hello, my name is Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to offer ways to accommodate mammogram technique for individuals who need special assistance. Individuals with intellectual or developmental disability, also called IDD, may experience anxiety in medical encounters related to unfamiliarity with the situation or a past difficult experience. Lack of cooperation may be related to anxiety and can create challenges in imaging some patients. First, consider how to best communicate. Verify potential differences in receptive and expressive language skills. Acknowledge accompanying caregivers and verify their roles. Key points in communication are: speak directly to the individual, explain and demonstrate. Information is easier to understand when large ideas are broken into smaller parts. Visual tools can be helpful to aid in understanding. Speak and move slowly. Processing time is often slower for individuals with IDD. You may need to allow 15 to 20 seconds after asking a question to get a response. Use simple and comforting language. Use repetition and recap key points at the end of the conversation. Praise cooperation. Take 5 to 10-second breaks when needed. When checking in a person with disability, verify if they need any assistance or have someone to help them. When directing a person with IDD to the changing area, consider whether they need more than verbal instructions. They may need to be shown exactly what to do. They may prefer a support person to join them. Verify if the person with them is actually someone who can be with them when they are undressed, or if it's someone that they prefer to have wait in the waiting room. Offer direction for changing and cleaning skin in simple and specific language. Use short sentences. Include a visual demonstration of gown placement. Ask if there are any questions and verify understanding before leaving. In obtaining the history, ask questions of the individual directly. They may offer you a written summary of the anticipated questions, which you can review and then confirm. If they have difficulty in communication, ask permission to speak with the accompanying support person. For imaging, begin with an explanation of the procedure. Seek consent or assent. If there is hesitancy, demonstrate more simply, such as show how the machine moves or use a picture to show positioning. It is important to be truthful about the discomfort of a mammogram so that you can plan together how the person will prepare for and tolerate the procedure. Teach them how they will need to stay still. Explain that they can ask you to stop if they can't tolerate it. Explain that they should not try to pull out of the plates when the mammogram machine is in position, as this is likely to cause more pain. Ask about ways to provide distraction or incentive to ease and complete the procedure. Consider practicing some deep breaths. Check if the person uses an app like Calm to help them with pacing their breathing. Ask if listening to specific music or watching an enjoyable video on their phone might help. First, then language may be helpful. For example, once we have taken your pictures, what can we do to reward you for being brave and staying still? If the person has difficulty, try taking 5 to 10-second breaks within the procedure to help the person take a deep breath and relax. Consider if the support person can come assist if you are having difficulties. Respect the person's request to stop. You or the support person may need to assist your patient into the correct position on the machine. Explain in simple language what you are going to do before you do it. Use pictures to demonstrate. It can be helpful to show your patient the machine and have them touch it. Some patients enjoy seeing how the top plate lowers and the machine rotates before stepping up to the machine. Individuals with physical disabilities may need to sit in a chair or in their own wheelchair during the mammogram. Praise the individual for cooperation regularly. Give high fives or fist bumps. When imaging is complete, explain the timeline and process for receiving results. Answer any questions the individual may have, and verify understanding. Thank you for watching. To assist your patients in preparing for their mammogram, you can refer them to the partner video at 4rhealth.org. mammogram.org.